Neck surgeries have tripled in the last 20 years. And a lot of that has to do with our access to imaging. So you get imaging, you go to a surgeon's office, and he's gonna tell you if you have a bulging disc that you need surgery. And that's just not the case. And 90% of the people that are dealing with neck pain, they're gonna get better with conservative management, conservative treatment. And so with these exercises, these are essential. This is exactly what we do with clients. We do manual therapy in the clinic, but we do this as our home exercise program, and it's comprehensive. We're gonna get you out of pain and then keep you out of the surgeon's office. Let's get right into the exercises. So first thing I need to do is I need to work on thoracic mobility. I need to be able to move through my thoracic spine to limit the motion through my neck. So I grab this, we call it the Texas towel roll. This is the first level. This is the second level. It's a little bit spongy, it moves, has some give to it. And then the third is a lacrosse ball. We got two taped up right here, and that's really stiff. And this is really for larger guys. You'd get to this level. With normal sized women, this is our ideal, but we start with something that we can relax with. So what I'm gonna do is I'm gonna lay down right here, and this is all the tools that you need. So this is a dish towel that's just rolled up. So I'm gonna lay it right here. I'm gonna put it, I want it to be underneath my shoulder blade. So just right here, starting point. So I'm gonna lay it down on the ground, and I'm gonna get on top of it. I'm gonna do a chin tuck. So I'm tucking my chin like this, lengthening out my spine, and then I just breathe and relax. I need to keep my knees bent while I'm doing this. So that keeps my back flat. So if I straighten out, my pelvis kicks up and I get this big curve in my back, and then that takes some pressure off of the towel. We want it to be at a level that it's uncomfortable but tolerable. So I just breathe and relax right here with my chin tuck pre-position, and I'm gonna take 10 breaths in this position. Just breathe and relax and fall into it. And now I'm gonna show you with one of these. I do it with the double lacrosse balls right here. So I'm gonna go like this, lay down, get it underneath the shoulder blades, chin tuck. So with whatever we're using, this is uncomfortable but tolerable for me, but I do it almost on a daily basis. So I breathe and relax. If you get something like this and your head is in this position, that's why we have these pillows right here. I want you to make sure that your neck stays in a neutral position and we are not irritating it with these exercises. It is essential that we're not making things worse while we're actually putting together a program where we're trying to make it better. So I get into this position, relax. The position of my hands is important. I can put them here, I can put them here, palms up. I can put them out like this, palms up. In this position, that lengthens everything out. Breathe and relax. When I let my breath out, I'm always sinking down into it. The only position I don't want with my hands is palms down. You can see what happens with my shoulder. Palms up, palms down. My shoulder blade tilts into a position where it's anterior tilted, and that's where we have a lot of these problems coming up into our neck. So always want to do this with our palms up. So that's my first spot. I'm gonna do, let's condense it down to 5 breaths in that spot. I'm gonna move myself down. When I move down, I'm not pushing with my head. I don't wanna cause any extra irritation to my neck. So I move down about 1 inch, 5 breaths. Then I move to my third spot, almost to the top of my shoulder blade, at least mid shoulder blade level. Palms up, chin tucked, drop my back down. Breathe and relax. And that's it for that one. Now let's move on to number 2. Now we need to work on pistols. This is number 2. So what I'm gonna do, like with this double lacrosse balls, gonna be a lot less aggressive when I use something like a towel roll right here. I'm gonna do it long ways, and I wanna be in between the spine and my shoulder blade, right in that space. So now I get into it, and now chin tucked, same position with everything. Now I'm gonna make a pistol with my hands, and I'm gonna rotate into it. I go about 30 degrees, just gliding into it. So I'm working on that muscle tissue in between my shoulder blades, in between my shoulder blades and my spine, but I'm also getting some pressure on my rib cage. My rib cage is right here. I'm putting some pressure on my rib cage to get those ribs to be gliding, and those ribs are gonna take the thoracic spine with them. So we're getting that mobility So I just do 10 times, just gliding over to the side, and you see that my knees are coming with me, my Superman emblem and my belt buckle are gonna stay stacked while I do this, and my head's going with me too. Same thing with this one. I want to keep my neck in a neutral position. I'm doing 10 one way, then I'll shift my body over and get it set up, and then I'm just gonna do 10 the other way. Okay, so now we worked on our mobility. Now we got to get some blood flow to those muscles. This is number 3, we call it no monies. I don't have any money, bro. So what I want to do, I can come out to here all the way, and that's doing external rotation. What I'm really looking to do is get my shoulder blade to tuck back and down. So I'm going to do this. Shoulder blade leads the motion, comes to here instead of coming all the way out to here. So you can see the difference right there. So what I'm going to get this, the band right here, elbows at my side directly, chin tucked, and I'm squeezing my shoulder blades down and back and letting them back in. So it's taking about 5 seconds to do each rep, and I'm going to do 10 of them. You should see my chest opening up because my shoulder blade's tucking down and back. I'm going to shift around to this side so you can see it. Pinching those shoulder blades down and back, nice and slow. Going from each direction, maintaining. I don't want to do this. I don't want to hyperextend in my lower back. I got to stay stable with my lumbar spine and stable with my neck. I'm creating the motion to happen through my shoulder blades and through my rib cage and my thoracic spine. So I'm getting blood flow in there, but I'm strengthening up those muscles that we just mobilized as well. Now, number 4, we're gonna do something we call Batman. So it can be called an I. You got I's, Y's, and T's. This is an I. This is the most effective way to get your lower trap fired up, which is a very important stabilizing muscle for your shoulder blades. Anything that helps with your shoulder blade motion is gonna help with your neck. So I got these pillows set up so we can do it at our house, right? So I just get a double pillow setup. I'm gonna lay on my stomach, I'm gonna tuck my belly, I'm gonna tuck my chin, and then I'm gonna externally rotate. I'm gonna turn my palms out and my thumbs up, and I'm gonna just hold that position for 30 seconds. So I'm laying down right here. You can do this on a bench, a workout bench, but this is an easy way to do it at home. So I'm gonna come right here, belly tucked, chin tucked, and I'm pulling my shoulder blades down and back. My elbows stay at my rib cage. They don't wanna come up here because that's tilting again with my shoulder blades. So my shoulder blades lead, I'm holding this, I'm coming out. You can see my upper trap's not doing anything, it'll wiggle around. I wanna be pushing down and in with both shoulder blades, and I'm just holding that for 30 seconds. I'm gonna rest for 10 seconds, and then I go back into it and I hold it for 30 seconds. I also don't wanna overextend in my back, so I gotta tuck my belly, tuck my chin, squeeze those shoulder blades down and back, turn those palms out, thumbs up, breathing and holding it for 30 seconds. And I'm just activating those muscles. Now, number 5, we're gonna lengthen all that tissue. We gotta do, if you're stretching, we're working on mobility, we need to do it in chains of muscles because they're all connected with fascia. So we call this threading the needle. So what I'm gonna do is I'm gonna get my left hand out, palm up, all the way out here. I'm gonna put my right palm on top of it. So scoot over to the side a little bit so you can see everything. Right here, palm on top of it. I'm gonna drop my head. I'm gonna have less than 1% pressure on my head, but it is gonna touch the ground. So I come right here, and I push with my right arm, coming across, and I'm gonna take 3 breaths. So you should feel that stretch all the way around to the other side of your back. And so now I'm gonna switch sides with it. I'm doing 2 reps on each side, just like this. I'm putting this hand all the way across, palm on top of it. I'm dropping that head down, and then I'm pushing over to the side. Very little pressure on the head though. Make sure that we're not putting any pain into the neck. If you are, take your head up. It's not gonna be as efficient, but at least we're not causing any extra pain. But I very rarely, if you're doing it correctly, doing it correctly, then you're not gonna have any pain in your neck. A lot of our clients do this exercise and they never have pain in their neck when they do it because they're not putting too much pressure on it. It's just a little bit of pressure pulling it right there. Make sure you follow us for videos like this, things that we do that actually work with people, because we work with people here in the clinic, which is rare. When somebody posts stuff online, that's their full-time job. They don't actually work with clients and fix their problems. We have over a 90% success rate, and we're willing to post everything that we do here in the clinic. So you can trust that we've tested this stuff out with all of our clients. So if you want any more detail, if something's not clear, you need more specific information, just comment neck and let us know what you need. We'll post a video directly for you. We want to make sure this is impactful and helpful. We'll see you in the next video.